We've long known that a major cause of foot pain and other problems is calf tightness. But you're looking at the ArchSafe, the first device ever clinically proven to lengthen the calf muscles of your patients.
I've been very impressed with the results to date, and I intend to keep using it.
I felt muscles stretch that I never felt stretched before in my legs.
And that entirely new stretch can help your patients avoid foot pain, plantar fasciitis, metatarsalgia, bunions, flat feet, and other foot problems. The reason is because tight calves cause those problems by causing foot strike on the ball of the foot. That abnormal foot strike stresses the plantar fascia and foot muscles because they literally have to move out of the way so the heel can reach the ground.
There's been numerous publications that have shown association between calf tightness and problems in the foot and ankle.
Most of us believe that calf contraction may be the cause of all these conditions.
Dr. Prasad Guranini is an orthopedic surgeon at Christ Hospital in Chicago. He noticed his patients with foot problems and no other obvious cause had calf tightness 80% of the time. It showed up when he supinated the foot.
When I lock the foot in supination and dorsiflex, she's short of supination by about 10 to 15 degrees. This is typical of calf tightness that's subtle and not seen on routine examination.
Dr. Guranini felt there had to be a better treatment than Achilles lengthening surgery. That not only involves an operation, but can weaken the Achilles muscle. Dr. Guranini realized the only way to effectively stretch the calf muscle was to lock the foot in that same supinated position. To accomplish that, he developed this, the ArchSafe. Michael Watkins started using the ArchSafe last year. The lifelong jogger had such severe Achilles tendonitis, he decided to stop running. Then he used the ArchSafe just a few minutes a day.
This is the best that it's been in 20-some years since I originally injured it.
There are other devices like this one to stretch the calves, but they don't lock the foot. Notice how splayed this man's feet are. Because such devices don't lock the feet in supination, experts have found they often do more harm than good.
They stretch the plantar fascia before they can actually stretch the calf muscle, which is not good for the foot.
Can that make the problem worse?
It probably exacerbates some of the problems we already talked about.
The ArchSafe, however, isolates and stretches only the calf muscles. Patients actually feel a stretch they've never felt before. We asked this fitness instructor to use the ArchSafe for the first time. Can you feel the difference than with other devices?
Yes, because I feel them all the muscles of the calf working separately. They're each working independently. It's very good and surprising.
Surprising and clinically proven. This recently presented study showed subjects using the ArchSafe just a few minutes a day effectively lengthen their calf muscles. It's a medical first.
Our study with the foot locking technique is the only one out there that showed that you can effectively stretch calf muscles without surgery.
In fact, Dr. Guranini has used the ArchSafe over 4 years with hundreds of patients. None has gone on to require surgery. In addition, none has had any side effects. Endorsed by orthopedic surgeons and podiatrists, the ArchSafe marks a new era in treating foot problems. It's the first totally safe, effective, inexpensive way to treat and prevent common foot conditions.
This is very good. This feels awesome.
I think it's going to help a lot of people, especially runners.
People do surgery for plantar fasciitis and all these other things which can be avoided.
The ArchSafe can make that kind of difference.
I believe so.